Each year, nearly 800,000 people have a stroke, which is the top cause of serious long-term disability. Today, we're talking about how rehabilitation can help improve mobility and independence after a stroke. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week, I'm joined by Dr. Brad Steinle, a physical medicine and rehabilitation specialist at St. Luke's Rehabilitation Institute. Thank you so much for joining us.
Well, thank you, Lindsay, for having me.
So first of all, Dr. Steinle, what are the most common complications of stroke that can cause disability?
Well, the complications of stroke are often determined by where the stroke was located. If a patient has a right brain stroke, that can cause paralysis in the left side. It will also cause a condition where they neglect that left side as well. It will cause difficulties with problem solving. It will interfere, obviously, with their ability to walk if they can't move their left leg very well. A left brain stroke affects communication as well as causes right-sided paralysis. They will have difficulties communicating, both understanding words as well as being able to speak words. And so that's very impairing as well. If a patient has a stroke in the brainstem, that can affect their ability to walk and then also cause paralysis on one side or the other, but also can cause double vision or difficulties with swallowing. And then finally, the cerebellar strokes affect more coordination rather than causing weakness. And so depending on where the stroke hit, tells us which direction we need to go with our therapy program.
Now, is rehabilitation needed for all people who suffer a stroke?
Well, it certainly depends on the degree of deficits they experience. There's been a lot of game-changing what our neurologists and neurointerventionists can do with clot retrieval and the intravenous clot busting drugs that they can give make a big difference with this. Typically, a patient may need therapy regardless of whether they had the clot busting drugs or the interventions, compared to not having anything. But that's going to change the severity of the stroke. So patients that have had stroke, they may start with their therapy in the ICU, and then they'll proceed to working with a physical and occupational therapist or speech therapist when they're in the acute hospital. Then we determine what level of rehabilitation they're going to need going forward.
Okay. Now, what can someone expect with rehabilitation after stroke, and how does it really help improve mobility and independence?
Well, the improvement in mobility and independence is dependent on the work that they do with a therapist. There's a learning process with the repetitions that we're able to deliver with physical therapy. Basically, when we work with a patient, they learn the behavior all over again after a stroke. And so the therapy gives them ability to do repetitions.
Now, what makes St. Luke's Rehabilitation Institute unique for this region?
Well, I think the thing that makes us unique is we have a wonderful facility. We have great robotics, and we have talented therapists. We see the patient from the ICU until the rest of their life. I'll give you an example, Lindsay. I had a patient last week that we took care of in 2005. She had a catastrophic brainstem pontine hemorrhage, and she could barely get to the side of the bed. In 2023, she walks. She has some impairment, and she has some communication impairment, but she is done fantastic. And she follows up with us about every year to get tune-ups for her therapy program, and that's unique to this area, and certainly unique that we tend to follow these patients for 20 years.
Having that continuity of care.
That's so important for not just for the rehab piece, but with neurology, with their primary care doctors, which are often provided through St. Luke's as well.
Now, tell me a little bit about these robotics that are offered at St. Luke's Rehabilitation Institute and how they're really unique for the area.
Well, we have a number of robotic devices, both for the arms and the legs, and you would really have to travel to Chicago or Denver to have exposure to some of the equipment that we have. Let's start with the lower body robotics. Those are devices that help patients walk. And we've worked with patients before we had robotics, but these robotic devices help us deliver intensity of therapy. For instance, in a 45-minute period, traditional therapy might get 200 steps in. Mm-hmm. With the robotic devices, we can get 2,000 to 4,000 steps in some instances. Wow. So we can just increase the intensity of the workout. The patient feels like they've really worked out, but that repetition helps build the recovery to help them become more mobile. with the arm, we have devices for the hand, the elbow, and the shoulder that work in a coordinated fashion to deliver those repetitions for hand and arm control, which is very important for everything we do in our life.
Right. Now, are there any factors that can affect the outcome of stroke rehab?
Well, certainly getting to a hospital sooner is very important because we do have interventions. 20 years ago we didn't. And so that's going to make a difference with their total outcome. Getting involved with a strong therapy program is going to be critical to their recovery if they do have functional deficits.
Okay. Now, is there anything else you'd like to add or end on today?
Well, yes, I think, we talk about the wonderful buildings that we have and which are fantastic, and the robotic devices that we have. But a building is just a building until you put talented professionals such as therapists, nurses, and the physicians that provide care. I think that's what the separator is, or the differentiator is for St. Luke's Health System.
Absolutely. Well, thank you so much for joining us.
Oh, thank you for having me.
To find out more, you can visit stlukeskc.org/rehabinstitute. You can also stay up to date with all the latest health news and stories from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.